African Americans and Latinos lead the way in chronic obesity and associated health impacts. We learn why weight loss surgery is the treatment course to consider. It's all here on the next Latino Motion. Join us.
Choose to get lost in the woods to gain experience in forest management.
Choose to travel through time to understand the past.
Choose to soar to pursue a career in dance.
Stockton University offers 50 high-quality academic programs, small class sizes, and affordable tuition. Choose to match your interests and talents at one of New Jersey's nationally ranked universities.
Latino Motion with Bert Lopez is presented by Latino Motion Public Affairs Media, a New Jersey nonprofit corporation, and Stockton University. This edition of Latino Motion with Bert Lopez is brought to you by the HD Studios at the campus of Stockton University. Funding for Latino Motion is provided by AtlantiCare, a member of Geisinger. Atlantic City Electric, energy for a changing world, and South Jersey Gas.
Health disparities in the Hispanic community is a major concern for us here at Latino Motion and ALMA, an AtlantiCare Employee Resource Group. That is why we are partnering to present this health segment. Tu salud es importante para nosotros.
Welcome to Latino Motion, a weekly interview show highlighting issues impacting New Jersey's Latino community while advancing understanding of Latino cultural heritage and contributions to our society. And here is your host, Bert Lopez.
Buenos dias and welcome to Latino Motion. Overweight and obesity among African Americans and Latino at just over 70% compared to 60% for whites. However, minorities are significantly less likely to seek treatment. Joining me is Dr. Samir Patel to discuss this important topic. Doctor, welcome to Latino Motion.
Thank you for having me.
There seems to be a big disparity. First of all, the data shows that most of us seem to be overweight, and obviously there's a significant number of obesity, particularly within the minority communities.
It seems that 30% of Americans are morbidly obese and they are candidates for surgery, yet there's a large fear among patients undergoing surgery for weight loss.
Well, let's talk about the impact of being overweight and obesity. Obviously, there's a lot of health implications. Tell me about those.
Well, being overweight, especially morbidly obese, increases your chance of getting diabetes, high blood pressure, sleep apnea, and heart disease, as well as increases your chance of getting certain types of cancer. So diabetes affects all the organs, all the way from the brain to your eyes, your skin, your heart, your GI tract. That's also one of the other silent killers. You know, high blood pressure, heart disease, also all related to being overweight. The higher your weight is, the higher your chances are of getting these medical problems.
And we know that significantly within the Latino community, there is a significant number, disparity, if you will, in terms of diabetes. And obviously, weight is a big risk factor.
The other thing within the Latino and African American community is the way the fat is distributed on your body. A lot of the white patients have their fat distributed on the outside of their organs. But Latinos and African Americans have a lot more fat distributed around their organs, such as the liver and the pancreas and their heart. That increases their chances of getting diabetes and high blood pressure. So if we compared a patient who had a weight of 250 pounds or 100 pounds above their ideal body weight, who was white, compared to a person who was African American or Latino, their chances of getting diabetes and high blood pressure are less compared to the minority community because of the fat distribution on their body.
That's an interesting fact. Let's talk about the difference between being overweight and being obese.
So what you do is you take a ratio of your height and a ratio of your weight, and you come up with a number called the body mass index. And your body mass index should be between 18 to 25. When it's between 25 to 30, you're considered overweight. When your body mass index is between 30 to 35, you're considered mildly obese. When your body mass index is between 35 to 39, you're considered severely obese. When your body mass index is 40 or greater, you're considered morbidly obese. So when your body mass index is between 35 to 39 with a medical problem, you're considered a candidate for surgery. When your body mass index is 40 or greater, even without medical problems, you're still considered a candidate for surgery. Because studies have shown that if once your body mass index is greater than 40, you're guaranteed to get a medical problem, which will cause you to have worsening complications in the future and dying prematurely. And that's why even though your body mass index is greater than 40 without a medical problem now, you're guaranteed to have a medical problem in the future, so you're a candidate for surgery.
At what point should someone be seeking, at least consulting a professional about their weight?
I think once your body mass index is greater than 30, once you start reaching the obese category, then there should be some sort of consideration for seeking help for treatment for some sort of diet and exercise, even some medical therapy to help slow the progression to becoming, severely obese, with a body mass index greater than 35.
And it seems to be that disparity right now because obviously there is less of the minority population that's actually seeking treatment for being overweight or obese.
Yes, it seems that, once the medical complications start, such as diabetes and high blood pressure, their medical doctor may tell them to seek help for weight loss surgery, but there's a lot of fear surrounding the weight loss surgery, so they seem to be content taking the medications and just holding off on seeking help when there's a true treatment out there.
Are there other access issues that you see within the minority community?
I think there's always, insurance problems, insurance issues when it comes to like weight loss. The insurance companies feel that weight loss is, not a medical necessity, and they may not cover the surgery, and I think that's a big issue overall.
So obviously seeking help sooner than later before those complications come in is very important.
Yes, I think there should be a lot more education about dealing with the fact that being overweight causes medical problems, which will decrease your lifespan. And by seeking help to help lose weight, you can improve your lifespan and improve your medical condition overall.
I want to discuss a little more about some of those treatment options. Obviously, there's a lot of advances and there's really useful treatment that could be had. We're going to discuss that in a minute. We'll be right back with more Latino Motion.
Latino Motion with Bert Lopez is presented by Latino Motion Public Affairs Media, a New Jersey nonprofit corporation. Join us online at www.latinomotion.tv. Find us on YouTube, Facebook, and Twitter. We encourage your comments and contributions for show topics.
Welcome back to Latino Motion. Weight loss surgery has become one of the primary treatments for chronic obesity and type 2 diabetes. I'm back with Dr. Samir Patel discussing these treatment options. Doctor, welcome back to Latino Motion.
Thank you.
So we discussed the big health impacts that obesity and being overweight does have on individuals. Why is surgery an option, a viable option?
So there are several options for weight loss surgery. And studies have shown that gastric bypass surgery is the only treatment option out there that will cure diabetes. It will put diabetes into remission. Studies have shown that even with weight loss surgery, you have to lose 50% or more of your excess body weight to make a huge impact on your medical problems long term. Surgery is the only thing that can do that.
Let's talk about the fact that not a lot of people are turning to that option. You mentioned earlier there's fear of surgery, but yet we see knee surgery, hip surgery being commonplace. Why hasn't the weight loss surgery as common as these other type of surgeries?
Laparoscopic surgery for weight loss has been around since the 1990s. We've gotten surgery so safe that the complication rate from weight loss surgery is equal to complications from hip surgery. Yet patients have no problem undergoing a hip replacement or knee replacement because they have knee pain or hip pain. Yet with patients with diabetes and high blood pressure, they're so afraid of having weight loss surgery because they don't realize how safe it is that they rather continue taking their medications and decreasing their lifespan and making their health worse because of this unfounded fear.
Now, you mentioned that it is a common procedure. It's a lot safer than maybe was in the past. What type of surgeries are there for weight loss?
Right now, there are 4 types of surgeries for weight loss. There's the lap band, which is done 4% of the time in the United States, the laparoscopic gastric sleeve, which is done 50% of the time in the United States, the laparoscopic gastric bypass, which has been around the longest, is being done 42% of the time in the United States, and the duodenal switch, which is done about 4% of the time. So the gastric sleeve and the gastric bypass are the 2 most common options for weight loss surgery in America today. And those surgeries have shown to help patients lose 50% or more of their excess body weight at the end of 1 year and keep that weight off for 10 years or longer.
Let's discuss the differences between those 4 options.
So the gastric sleeve, which is done 50% of the time in the United States, you basically remove about 75% of the person's stomach. So you basically reduce how many calories the person eats. And basically by eating less, you lose weight. Right now, patients are eating about 3,000 to 4,000 calories per day. So after surgery, you're eating about 1,000 calories per day. That doesn't sound like a lot, but studies have shown that all you really need to eat is about 1,000 calories per day with 60 grams of protein to basically survive. So by eating less and by going about your daily activities, you're going to burn off the excess calories that are on your body and burn off that excess fat, and that's how you're going to lose weight.
What about the so-called hunger gene or...
There's a hormone called ghrelin that's produced by your stomach. So when your stomach is empty, it produces a hormone that tells your brain you need to eat. Then as you eat, your stomach gets full and the hormone levels fall. In patients that are overweight, these hormone levels are always high, so they're always hungry. With the gastric bypass and the gastric sleeve, the hormone levels fall. So despite the fact that you're eating about 1,000 calories per day, which basically breaks down about a saucerful of food 3 times a day, you're not hungry. By not being hungry, you basically go about your daily activities and you keep burning off all that excess fat that's on your body.
Let's talk about who's a candidate for these procedures.
The best candidates are patients who have a body mass index between 35 to 39 with a medical problem such as diabetes or high cholesterol or high blood pressure, or a body mass index is greater than 40. Those are the best candidates. Some studies have shown that if your body mass index is between 30 to 34, so with diabetes, you're still a good candidate for surgery. Unfortunately, the insurance companies won't pay for that right now.
The procedure itself, is there a long recovery for once you have the procedure? How long of a recovery is it?
So unlike knee replacement or hip replacement, this is all done laparoscopically, 5 little incisions. Patients stay overnight in the hospital and they go home the next day. They're walking right after surgery.
Not sure that that's commonly known. Are there often complications from this type of surgery?
So the complications, from the gastric sleeve and the gastric bypass are about 1%. Same as a hip replacement. You get bleeding requiring blood transfusion, that's 1%, or you can get leaks, where basically part of the staple line has broken down and sometimes that's treated with repeat surgery, or sometimes it's treated with just IV antibiotics and drains. But also, that's also 1%.
We want to talk about some of the life impact, the life changes that this caused, and some success stories that you yourself have witnessed with the surgery. We're going to take a quick break. We'll be right back with more Latino Motion. Welcome back to Latino Motion. We're back with Dr. Samir Patel discussing the reality of weight loss and health impacts. And Doctor, we discussed the surgeries that are available for weight loss, and you compare the surgery as safe as hip replacement, yet there seems to be a taboo associated with weight loss surgery.
So a lot of things that I find is patients who undergo weight loss surgery Some of them are very happy and they refer other patients to me and they make it well known that they underwent weight loss surgery. The other half of my patients, they feel like their coworkers and their family think of this as a cop-out. They feel like, that diet and exercise, should have been enough for them to lose weight. And they feel that undergoing surgery is them throwing in the towel. They feel like they are failures by doing the surgery. And that's how they're viewed by their family and friends. So that's another reason why patients are kind of scared of coming forward for having surgery, because they don't want to be viewed as failures from their family and friends.
And of course, that seems to be the case, particularly within the minority community. One indication is that only 10% of minorities, African Americans and Latinos, are getting the weight loss surgery compared to whites. Locally, you're seeing a higher number, but the numbers are starting going low.
Right. The issue, I think, is, like you said, there's a taboo about patients in the minority community who feel that undergoing weight loss surgery is, again, a cop-out, and they should just continue to diet and exercise the best that they can. But yet, if they had knee pain or hip replacement or hip pain, they have no problem undergoing a hip replacement. Right. But yet, if they have diabetes or high blood pressure, they'll continue to take their medications, and they won't realize that the long-term effect of this is a decreased lifespan.
Now, there is success stories that obviously in your practice you witnessed. Tell me about some of those success stories.
So I had a patient who was 65 years old, was referred to me by an orthopedic surgeon. She was 350 pounds and she needed a knee replacement, but the orthopedic surgeon said she needed to lose some weight. After gastric sleeve surgery, she lost 125 pounds and she didn't even need knee replacement anymore because the pain went away. I also had another woman. She was 36 years old. She was 100 pounds overweight. She could barely walk to the supermarket and back, which was like 2 blocks away from her house. Once we underwent the surgery, she started walking more, started losing weight, and then she ran her first, 5K, and she continued to lose weight, and now she's basically running with her family, and bringing this family together and helping improve the entire health of her entire family.
You mentioned family. What impact or what role does the family play in the treatment of those who are obese?
What I find is that in patients that undergo weight loss surgery, they're eating better, they're eating healthier, and then the rest of the family also starts eating healthier, and they also start losing weight. So I think overall, once the weight loss patients make better choices for eating and exercising, the rest of the family follows suit. And they all tend to lose weight and become healthy as a family. And I've had patients who once undergo surgery have the family members come in also down the road to also continue the journey together.
Of course, surgery is not for everyone, and everyone's not a candidate for surgery. What other options do we have for weight loss, particularly when you're borderline to being obese?
So there's always, changing your diet. There's also encouraging exercise, and there's also medications for weight loss. Yeah. So there's one medication called phentermine, which is the most common prescribed for medication for weight loss in America. It acts like an amphetamine to help decrease your hunger. There's another medication called Saxenda, which is a medication which also acts on receptors in your belly that helps to reduce your hunger. So those are the biggest medications available for weight loss. Those are options for patients who are not candidates for surgery.
Obviously, living a healthier lifestyle and watching what you eat is also an important factor.
Yes. Medication alone is not the answer. You have to change your entire lifestyle. Eating more protein, eating less carbs, and try to exercise the best you can to help keep the weight off.
Are there any recommendations that you would have for a patient who's considering having weight reduction surgery? Anything that they should prepare for?
I think the first step is obviously understanding that surgery is one part of your weight loss journey. I always tell patients that surgical weight loss is 3 parts: diet, exercise, and surgery. I'll do my part, I'll do the surgery. They have to do their part. They have to do the diet and they have to do the exercise. If they do all three, they'll be very successful. So the first step, if they want to prepare for weight loss surgery, is changing your diet. See what you're eating, see how you can cut back on your calories, make healthier choices. Eat chicken breast instead of eating, a Big Mac. Eat a salad instead of eating French fries. Once you start making choices in your diet, as the weight comes off, then start, making better choices about exercising. Use the stairs instead of the elevator. Walk to get the mail, and then walk around the block. And then once you start seeing the positive impact on your lifestyle, weight loss surgery is so much easier.
Well, thank you so much for sharing that vital information. A lot of new facts here for me and certainly for members of my audience. Thank you so much for joining us once again here on Latino Motion.
Choose to get your feet wet, to learn more about protecting our environment.
Choose to read minds, to understand the human brain.
Choose to get your hands dirty, to create a masterpiece.
Stockton University offers 50 high-quality academic programs, small class sizes, and affordable tuition. Choose to match your interests and talents at one of New Jersey's nationally ranked universities.
Funding for Latino Motion is provided by AtlantiCare, a member of Geisinger. Atlantic City Electric, energy for a changing world. And South Jersey Gas. Latino Motion with Bert Lopez is presented by Latino Motion Public Affairs Media, a New Jersey nonprofit corporation. Join us online at www.latinomotion.tv. Find us on YouTube, Facebook, and Twitter. We encourage your comments and contributions for show topics.